Hello, everyone. I'm so pleased today to be joined by Dr. Lindsay Goodstein, who is an otolaryngologist with Clarity ENT. Um, she is a graduate of Yale University and got her MD at University of Maryland School of Medicine. She graduated magna cum laude and did her training at Thomas Jefferson University. Today, we're going to talk about her practice, her model of caring for patients, which is one of the reasons why I'm doing this series, so that she can extend to all of our membership her thoughts of the best way to care for patients and hopefully give you the information you need to model after that. So, with that in mind, let's just start with, can you describe your current practice that you are running?
Yeah, so first off, thank you for having me. It's such an honor to speak with you today. So my practice is called Clarity ENT. We're in a tiny little office in Spring House near Ambler in Montgomery County. We opened in April of 2023, myself and my partner, Dr. Marta Becker. And we left a larger group in order to create something that could be very um, personal for both patients and staff. So we have now built up an office over the last 2 years where we have really what is our dream in that we have a family of staff here. So, I believe that the patient experience starts from when they walk in the front door. So Adriana's been with us since we first started, and she knows the patient's names when they come in. And um, being in one office, we are able to set our schedule and really kind of take care of the patients the way that we want to do it. And having a staff that knows the patients well, really, I think adds to that whole patient-centered care.
So,
Um, Go ahead.
no, so do you feel that you opened this 2 years ago? Is it's different perhaps than what you had practiced or been involved with before? Is this more patient-centered? You kind of brought that out. Are you able to deliver that model better with what you've now set up?
I think so. I mean, so when I started practice, I was with a larger group and it was great. And I got a ton of experience. I was very busy. I had good mentors, but my head was really focused on just kind of getting through the day, making sure I was proficient at my surgeries and making the right decisions for patients. Um, but the more I got into practice and the more I saw patients who were coming to me, maybe because I'm a woman, but they were really seeking someone who could take the time to listen to them, make them feel heard, and sort of practice shared decision making. So, in every patient encounter, it's taking the time to listen, taking the time to educate, understanding that patients don't always want a medicine. So really understanding the goals of their visit and then making a shared, using shared decision making to make a plan together on how we're going to treat them. And so one part that of my practice that enables me to do that is I'm just seeing fewer patients. Um, and I'm also able to slow down when I need to give them that time, bring them back in for extra visits, really do things very personalized to each patient in a way that when you're in a bigger group, not only are sometimes you're forced to see more patients, if you're in a group with multiple offices, things tend to get more streamlined, where in order to do things, the staff knows that when this patient comes in for this is how this is done. Whereas being in such a small single office, I can really dictate that care how I want to for every single encounter.
Now, it must have been fairly difficult to leave sort of an established larger practice and go out there on your own with just one other person in the practice, although it's ended up very well. So, what kind
Mhm.
of things can you tell us that maybe you'd wished you'd known when you made that move? Because it had to be difficult. that you could have told yourself maybe back then that you needed to know to get where you are now?
So, yeah, I mean, when we decided to do this, it was months in trying to make that leap. I mean, the hardest thing is just deciding what I'm doing right now is not working out for me and I'm going to do something different. That's a risk. Everything in medicine is so scripted. I just have to finish med school. I finish residency, then you get your first job. Okay, I just need to complete the junior associate partnership track until I get to the next thing. And you're always in this mindset that you just got to put your head down and do the work. And I think, the best advice that I could give younger graduates is to really think about what makes you happy and how you are fulfilled in what you do. And if what you're in is not right, it's worth jumping off that path. You're smart and you'll be able to figure it out. In terms of what to do to start a practice, that's a whole big conversation. And honestly, I'm still figuring that out. But and it's not anything I ever planned to do. I mean, the whole administrative, human resources, business, finances, billing, all of that. We went in clueless and just kind of faked it till we made it.
Well, so, but the best thing I'm hearing about it really is that you have that word you hear thrown around all the time, autonomy in what you're doing, autonomy and how you set up your practice, autonomy and how you are taking care of your patients.
It's 100% that. And I think over the course of doing this, I realized autonomy means a lot more than you think it does. And I think you were just alluding to that. When I think of, oh, I want to be in private practice because I want the autonomy to leave work early to go to my kids' school events. Yes, I have that autonomy, and that's wonderful. But I also have the autonomy to make my schedule how I want, see the kinds of patients that I want to see. I have the autonomy in who surrounds me, in my staff, and who I'm working with. I have the autonomy to do things that you can't do sometimes in bigger institutions. So, one of the fun things about my practice is that in the last 2 years, I've been piloting and bringing in office surgeries and procedures. That's been really fun and are things that there was some pushback to offer at my old practice. And I know at universities, you have to go through a whole process for approval of using these devices, but there's no one stopping me. So that's been incredible to have that kind of autonomy in what procedures I offer too.
Yes. And in a way, autonomy, from what I've seen and talking to various physicians who have established a practice where they have autonomy, it really leads to better patient care and better
Mhm.
patient satisfaction with what you alluded to, shared decision making and being able to offer all the services
Mhm.
that you can to make their care better. Economically, though, do you think this is a feasible thing for most physicians to do, to make that leap of faith you did, that it's just going to work out? I mean, that's probably what
Yeah,
scares a lot of people.
I have no idea, but I will tell you, there are lots of patients that want help. And if your number one focus is providing quality care to patients, everything else will follow. Um, and that's how we got started. And I will tell you that for us, it was an investment in starting before everything else was put together. So if you could see how much money we lost in billing in the first 6 months, because we didn't even submit charges, because we didn't have the credentials, but we saw the insurances anyway. We didn't get referrals, all of these things. But in our mind, we just needed our doors open and getting those patients in, and everything else we were going to figure out later. I think we're very fortunate in ENT that we can get by as a tiny practice because we're so procedure heavy. We have good reimbursements. Um, so I recognize that, in other specialties, I think that financially there may be bigger challenges, but I think there's ways around it if you're providing good care to patients.
So do you see this then, at least in certain types of practices, as something that will grow? Because what I'm seeing growing, all of us are seeing growing, is larger and larger and larger health systems. sort of gobbling up
Mhm.
the docs and making them all employed. I, like you, am in private practice and love it. But at this point, it seems like things have been shifting the other way. Everybody employed by these larger health systems. But I'm finding in these conversations I'm having more and more doctors saying they want autonomy. They want to be able to give better care to their patients. What do you see as our future? Do you think more practices like you have will begin to populate the area?
I don't know. I mean, within the landscape here for ENT, there aren't that many of us. There used to be a number of smaller practices, and most of them were bought by private equity. There are still some other private practices out here. But even in private practice in ENT, the trend is to merge and become a really, really large multi-specialty ENT and allergy type group. So there's a big group in New York and New Jersey that just opened up shop in Pennsylvania.
Mm,
Um, and all of these groups have reached out to us to
yeah.
bring us in. Um, and as long as we can get by, they sell, well, you don't want to do the business side, you're gonna burn out. Well, for me, I burned out when I didn't have control. And for now, I haven't had a disaster happen yet. There were days in the first year where we actually closed clinic because we didn't have any staff when everyone was sick. I mean, there are challenges that you can encounter that in a bigger group you wouldn't have to worry about. But right now, that kind of extra work sort of adds interest and fun to the job. And so I don't want to join another group, and I don't want us to grow outside of our one office, because as soon as you have multiple offices, you lose that. I hate to say it, but I guess I like control, because if you have multiple and then you have staff that are in different places, you can't oversee it in the same way. You that When a patient calls with a problem, right now, a lot of times that patient is a known person, and my staff can say, "Hey, Dr. Goodstein, this patient's having this issue. Should we bring them in sooner? What do you want to do?" And if you get too big and in too many offices, you lose that personal touch.
Right.
Um, so
I think some of it may be messaging, and I'm not quite
mhm,
sure how to get the message out there, not only to our fellow physicians, but to patients that although few in number, there are these
mhm,
practices out there with physicians like you who are wanting to set up these smaller, more individualized practice. Do you have
mhm.
any ideas? How do you market, or is it at this point word of mouth? Your patients all know you and they tell other people.
Yeah, we have spent $0 on marketing. Um, we're lucky that, my partner, Marta Becker, she's was in practice for 20 years, and I had been at my prior group for 5, and we reopened in the same area. So her name especially is a very well-known name in the area, and lots of patients have followed us here. Um, the marketing that I have done is specifically to other private practice, family physicians, pediatricians, and internal medicine doctors, to let them know that I'm here. And just by trying to visit them, meet them, give them my cards.
Yeah.
Um, I have a social media account and have some posts on there. I only have a couple hundred followers. I don't think that's the marketing. Um, Probably the number one marketing mechanism has been Google reviews. And the majority of my new patients come in because they search for an ENT near them and they see my name and read the Google reviews.
Can you think of anything else in terms of education of our physicians that you would want to add? I mean, they do not teach this in medical school about setting up practice and the importance of physician autonomy and centered care. That's just not where the thinking is. How do we get the message out? And also to other physicians who are changing mid-career. We're getting a lot of that too, who are
Yeah.
want to go out on their own after being burnt out in large health
Mhm.
systems.
Well, I mean, the first thing that came to mind is really a message to other surgeons. As an ENT, there's a big push to do fellowship and then work for an academic center.
Mhm.
And being in private practice, general ENT, or the buzzword now is comprehensive ENT, it's really its own specialty. And for me, it was what I wanted to do from the beginning, because I think for the number one thing that gives me value is forming those patient relationships and problem solving and helping give them a diagnosis or a solution or a plan. And so, I think as a surgeon in training, you should have the courage, if that's what gives you meaning, that's an acceptable path to follow. I still do a lot of procedures and it's a lot of fun, but it's part of the practice and probably not the most important part of it for me. Um, and so really just trying to listen to and figure out what it is that you're searching for.
It's great.
Mhm.
Is there anything I should have asked you about your that you would love to add? Because anything you want to add, I love to hear it. I love to hear about physicians going out there and taking control, but main thing, by taking control, taking better care of their patients. I mean, that's perfect.
Yeah. Um, well, it sort of in my mind came up in regards to marketing too, is one other aspect of my practice that I've really enjoyed is as I came out on my own, I started reaching out to other people in the area for help. And by doing so, I was able to actually make connections with other doctors in other specialties too. So I can now actually see a patient and text the allergist that I work with and say, hey, I'm thinking this, what do you want to do? And so that also adds so much more meaning to my career, to actually be able to collaborate with other doctors on a personal level. Well, and in a way that when I was so busy and in a group practice, I just hadn't had a chance to make those connections. And so just knowing that, like, if you do want to start out, everyone wants to help you. There are lots of people who want to help you, and there are a lot of people who want to work with you.
Well, this is
Hmm.
fabulous. I have to say, these interviews have been great. I mean, there are a lot of courageous physicians going out there, and
Yeah.
all of them have a similar story. It's starting it out at the beginning. It was not easy. So, but they're
Yeah.
all,
And
I
it
get
is
the
still
same
not
answer.
easy,
It's worth
but
it's worth it. I'm getting
yeah,
that universally. It's worth it.
yeah.
It's hard, but it's worth it.